morning. Can I get a show of hands who here is happy with their healthcare services? Okay, one person. Well, maybe two. So I think in general, we're all looking at how we can improve healthcare. So let's look at what's broken in healthcare to start with. None of this may be new to people here, but I just want to rattle off some of those points. So out of the $4 trillion that's spent in healthcare today, about $1 trillion goes into administrative costs. That includes billing, insurance claims, understanding whether a claim is being paid or whether it's pending, customer support, calls that basically lead to going nowhere. As a physician, you're on an average spending 10 plus hours doing admin work. Nurses do even more. Then in 2026, we think that healthcare spend will be about $6 trillion. 25% of that will go into what we call as fraud, waste, and abuse, stuff that should not really happen. And our solution today is to sort of add more bodies, more people to solve the problem. So we're band-aiding the problem by adding more people to solve this problem. And it's actually going nowhere because it's a pretty inefficient way to scale the problem, or solve the problem, rather. So what does it mean for all of us? One, we're all paying more premiums as a family. Since 2011, it's gone up about 50%. And it's only going to keep going up because the admin burden is sort of passed on to us as consumers to sort of socialize that cost. So what we're really witnessing is that we've created a healthcare system that's become a very chore-driven as opposed to care-driven. People should be more focused on getting care, getting time with the care provider, and finding solutions for their healthcare needs, as opposed to the stakeholders in the system sitting there trying to somehow getting paid in the system. So not all is lost. I postulate, this is my personal opinion as an AI practitioner, that I think that this new version of AI, generative AI, large language models, there could also be small language models. You will hear throughout the day many of these breakthrough through other speakers as well. I think this version of AI has the maximum potential for us to solve some of the operational burden, and specifically in healthcare, and I'll explain why. Because this is a key breakthrough that we have understood natural language better than what we've done in the past. But before I can explain why this breakthrough is important, let's look at a few pointers from history. With Industrial Revolution, what we saw is the general quality of life for humans improved. The human experience improved. We had better breakthroughs in medical technologies. We could transport drugs. We could manufacture, store them, and transport them to where the needs were. So basically, the quality of life improved. People found purpose and started doing more things. We saw a repetition of that in the computing/internet era. More than 10% of our GDP today is coming from sort of internet companies. What that means is that with the new breakthrough, humans find new ways to do things. There is joy in doing new things. I think that's missing in healthcare. And lastly, something more familiar to all of us, with the mobile phone revolution and gig economy that's come in, people found ways to make income and find ways to find new experiences. I think generative AI is one such technology which will impact several fields. And as a practitioner in healthcare, I think that it would, in foreseeable future, I can't predict how long it'll take, but I think that this technology will disrupt the way we'll do things. At least that's my hope. So what makes this technology such a breakthrough? So I talked about generative AI has sort of cracked the concept of natural language. So Most healthcare technology and AI, at least in the past, has been a specialized group of people, software engineers like me, trying to build technology for healthcare. And in order to do that, we had to work very closely with domain experts. And those versions of technology would sort of be brittle because it breaks when the stakeholder is slightly different from the people that I've developed the software for. Where with large language models, we can now reason with language. So anyone who can speak English, actually that should really tell any natural language. Natural language is the new programming language. So if you can speak natural language or write natural language, and you can explain to a system how to think like how you would explain to a 10-year-old, you can now talk to machines and make machines do things. So that is the real breakthrough with generative AI. So guess what? Most of administering healthcare is actually dealing with documents, policies, documents, governance documents, stuff that's written mostly in English and legalese, so to speak, which we now can actually harness and bring it into systems and reason within the system. So what that really means is, if you look at, say, medical contracts, provider contracts, insurance contracts, member benefits, stuff that most of us don't even understand if we try to read ourselves, by the way. Medical charts, of course, physicians and doctors know how to read that, and nurses do as well. Claims data. Claims data is somewhat structured data. I deal with that every day. But even in that, there are so many things that we could reason with English. Patient interactions, all of that happens at the point of care. Doctor's notes, nurses' notes, and a lot of other stuff is unstructured and structured data is mostly in natural language that we can now extract using language models, represent them in systems, what we call as embeddings. This is not a technical talk, so I'll try to avoid being very technical here. But you can please reach out to me if you have questions on that. The thing that matters most is representing that language that's in those PDFs and other documents, and represent that in a machine represented way called embeddings. And with the right context, based on where the person is or what's happening to the person, we can write prompts. Prompts are nothing but English explanations of how to reason with it. And once that is done, we can let the language models or generative AI run with it. So what that really means is that we can teach a large language model to reason with medical data. It could deal with like policies, governance, but it could also deal with patient-specific data, which it has never seen before, because you don't want to train on patients' data. So let me explain what I'm doing at Lyric. So Lyric is in the business of what we call as payment integrity. So that's part of the healthcare administration at the time of when a claim comes in and what happens to the claim. So a lot of decisions get made, and some of these decisions get made across many system boundaries and across many different stakeholders. But in order for a clear decision to be made, whether the claim is true, there's no fraud, waste, or abuse, and it needs to be paid out right away, there is a lot of medical policies that go behind the scenes to enforce that. And a lot of these policies are written by CMS or HHS or state mandates, or even insurance companies have their own list of policies. So what we're doing at Lyric is taking all these publicly available policies, stuff that becomes actually like enforceable claims adjudication rules, we take that and we're learning through that how to like automate that, because it's a lot of it is reading medical texts and going from there to like enforcing it as a policy. So within the payment integrity space, there are many jobs to be done. So from the time you go to a hospital, actually it even starts before you go to a hospital. So before you go to a hospital, you need to know where to actually like get care. So you may have an insurance app that tells you what are the providers in your network. You choose a provider, but then you really don't know whether it's covered or not. But when you go to the hospital, your provider ends up billing the system behind the scenes. But there are many jobs to be done, and typically some of these jobs don't even happen within a single system or a single company or a single insurance company, for example. So it starts with coordination of benefits. Do you have the right insurance? Maybe you have a spousal insurance. Maybe you're on Medicare. So there is a lot of confusion which insurance to use. And then it goes into prepay editing, which is the set of rules that government enforces to understand if a decision can be made on a claim or not. And then goes into pricing, and then so on and so forth. It goes into clinical reviews sometimes. Sometimes your advisor surgery, but the insurance companies need to look at if it really is valid or not. We've seen a lot of cases like that. And what you'll see is that the life cycle of a claim goes through many touch points, and these touch points don't exist in a single system. But with large language models, what we can do is we can train what we call as agents that know very specific subdomain of the data. So I can have an agent that knows coordination of benefits. In the previous slide, I'm training an agent that understands the whole prepay and postpay editing space. So you can have many agents, and now the agents can converse between themselves. What would typically take humans weeks, if not months, to understand why a claim is denied. You're getting on a call to understand if you're going to be covered. Your provider is getting on a call to understand why a claim is being denied. Your provider is waiting for approval from insurance companies. So there are a lot of manual processes that takes the joy out of everyone, and there is a massive administrative burden. We think that now with the current LLM AI, we can write agents that understand these things, and we can reason with the data, so we can sort of build a very operational, efficient workflows. That's the idea behind language models. So what does it mean? I think in the end, we can bring experiences that reduce the friction for all stakeholders in the ecosystem, whether it's an insurance company that has to field calls for patients, or whether it's a provider trying to understand why their claims are being denied, or it's a patient to understand what is covered, what is not, what's the price, is there a surprise bill later. Things like that can actually now be addressed because we can understand contractual data with different agents. So in this demo, I want to show you, and hopefully it's visible from far away, what an experience for a provider could look like if one of their claims is being denied for a patient. So Cynthia wants to understand why a claim got denied. She has a claim ID, but she doesn't know why that is. And Cynthia works on the billing side of a hospital system. So this is like ChatGPT, but it's specifically trained for policies and understands the denial reasons. So what you'll see here is that it explains the technical reason for a failure. It's a technical reason called as unbundled pairs. That basically means that there were two services that was administered. It should have been billed as one service, but it was line item. A trivial rule, but happens quite often. But what's important is that Cynthia now needs to understand a technical reason in her language that she understands, so she could resubmit the claim. This typically takes weeks, if not months. And sometimes they forget to do it, and the patient gets stuck with a bill. With experiences like this, to build an experience like this, I did not have to do a lot of work. I just had to train on policy data. But the fundamental understanding of how to explain something very complex in simple terms, because Cynthia is asking, can you explain that in simple terms for me? The natural language abilities on the large language models already has solved that problem. What would have taken me many, many months to develop in my previous NLP version of my AI software skills. In the end, it's about bringing joy to every stakeholder. We don't want to add more friction, whether it's for the patient or for the provider or any other stakeholder in the ecosystem. And I think we have tools now that can do that. And that's why at least in my opinion, the generative AI is the biggest breakthrough that we're going to see. So doing this comes at a cost. Just like every other AI, this generative AI can also make mistakes. So as a practitioner, it's very important to think about the different ways to to build responsible and safe AI. So we need to have good ground truth data sets on which we can like fine tune the models. We need to have bias and fairness. We need to detect and measure that. Generative AI goes wrong in another way. It hallucinates. That means it imagines things that's not probably there. So we need to ensure that its hallucination effects are very minimal. And we really cannot replace a doctor or a clinician when the clinical decisions have to be made. So we're not using AI to adjudicate a claim, but we're using AI to explain the adjudication. That's the important piece. So in the end, I want to conclude by saying that how do we know that we've moved the needle, right? It's good that there is a breakthrough, but do we know if it'll really work? And in my opinion, I'm seeing early signs of it working at Lyric, where we are bringing these tools that helps our own clinicians, in-house clinicians, get more efficiency so they can focus on the real thing, as opposed to being able to go download PDFs, read through thousands of pages that don't make sense, to focusing on the real clinical meat of the content that matters. So I'm seeing that happen, but how do I know that this is going to move the needle in the future? So I think one measure, in my opinion, is that we've been able to reduce the administrative burden, but also not remove jobs in healthcare. As you saw in all those other breakthroughs of technologies, it never really ended up with people losing jobs. People found more purpose, more joy in doing other things. And I think that's the opportunity that we have with generative AI in healthcare. Thank you very much.